It's wakey wakey, eggs and bakey, as they like to say. This is Dr. Toker, your friendly neighborhood colorectal surgeon. And welcome to, okay, why won't this work? I wonder. Hmm. Welcome to our morning podcast where we're going to discuss aesthetic beauty and gut health. Um, hang on, I know some of you are probably thinking, Toker, why would a colorectal surgeon have any knowledge of aesthetics? It's a long and drawn out story, which I'm not going to bother you with. But basically, in my surgery residency, we did a lot of plastic surgery. There was a lot of plastic surgery residents that came out of our surgery residency. So a lot of people graduated and then went into plastic surgery. So it was a focus of our hospital. So I was exposed to a lot of that. But more importantly, nutrition of the intestinal tract improves your outward aesthetic appearance. And so, in my line of work, as I'm talking intestinal health, it's interesting how many people come back in the office talking about how their skin complexion is better, their hair and their nails are better based on advice that I give for, let's say, their diverticulitis. So the two don't seem congruent, but they're definitely related. And so the point of today's topic is to educate people on how those things are actually related. Let me go over here. And so my little slides, as per usual, is housekeeping. As per usual, the slides will be on our website. Also, as per usual, my Thursday morning lectures are indeed sponsored content. So, informed consent time. Towards the end of our discussion, I will be explaining a technology called Super Patch and how one might use that to help your bodily process of improving both gut health and aesthetic beauty. The two are related, and yes, this technology can assist in the remodeling of your tissues by supporting your neurologic system. And we'll talk about that. So, okay, so I said who I was. I said good morning. Okay, housekeeping, that's done. All right, very good. Okay, so topics of the day. We're going to discuss number one, the lining of your skin is called epithelium. Epithelium means it's surrounding you, it's on the outside of you. There's something called endothelium, which means it lines the continuity of a tract that is part of the aerodigestive system. So in this instance, we're going to be talking about the endothelium of the intestinal tract. The process of detoxification, if I can get to it, because that's a complicated process. And then neurologic control, of course, that's the purpose of today's lecture, to understand that your brain works in coordination with the rest of your body to achieve the maximal health that you can achieve. And as it turns out, when you are in maximal health, it radiates as beauty from the inside out. Now, I do own a med spa. And of course, people are like, again, why does a colorectal surgeon own a med spa? And the answer, as I said, is that if you give people the appropriate nutritional advice, then the aesthetic procedures we do in our spa last longer and are more effective. So it does not make any sense to come to our spa and spend $600 on skin resurfacing and walk out and light up a cigarette. Like, these two things are just not congruent. So let's start with what is the aging process. And when people think of the aging process, they think of what your skin looks like. So I'm going to address that. But mind you, this same process is happening to every organ in your body. Aging occurs in patients over time because of hydration status As you get older, you tend not to drink enough fluids. I think as Americans, we don't drink enough fluids, and probably in the Western world. Oh my God, I went to Europe. Okay, Europeans, bear with me for just 1 second. Y'all don't drink water. I don't know. We spent so much time dehydrated in Europe. Now they will offer you coffee, the Italians. You're getting coffee and wine left and right. Water, can't find it. Whereas Americans walk around with these big jugs of water all the time. So we have two different societies, but all of us are woefully dehydrated, and hydration is critical to reversing the aging process. There is a protein called collagen. In the skin, it also contains elastin. Elastin is a type of collagen. It's in that family that allows the skin to stretch. And collagen is the protein matrix upon which your entire body is built, basically. And so collagen, elastin, hydration are the three critical components to your external skin. Now, muscular contraction occurs especially in your face. I mean, my face in particular, I'm very facially expressive. And all those chronic muscle contractions can lead to something called wrinkles. Structural loss. Now that's hard to reverse naturally. Structural loss occurs over time. It's a remodeling feature of your body. There are ways to address that. Naturally, that's sort of a hard thing to turn on a dime simply because this occurs over many, many years. If you're listening to this and you're young, let's say you're in your late 20s, start now. The clock is ticking now. Once you hit your 20s, the clock is ticking, okay? Oxidative stress. Now, we're surrounded by oxidative stress, whether you like it or not. And your blood sugar levels, and most people don't think about their skin beauty, their outward beauty, or even their health as being a blood sugar level problem. I have diabetics. I can remember as a resident bringing people in to cut off their limbs. They are diabetics and losing their limbs, and they still are drinking juice and eating high sugar component substances. It's like they can't put the two and two together. And so I'm going to go on a mission in the next couple of weeks to put that two and two together so people understand exactly what we're talking about. It is a silent killer, that blood sugar thing. Now, gut dysfunction, as it turns out, follows the same pathway as your skin. Hydration status, collagen, your structural loss, oxidative stress, and blood sugar levels. It's the same because the epithelium and the endothelium as a baseline structure are very similarly put together. All right, so let's see how that's done. Now, these slides, if you're listening on the little podcast, I apologize if I refer to a picture because you can't see that picture unless you've gone to my website to download the PDF, which you can do for free. So feel free. Or you can Google search. Yeah, if you put in the Google world or the DuckDuckGo, whichever your preference is, like histology of skin or epithelium, you'll get a picture that looks similar to this. And I don't know if my little pointer will work, but so you can see there's like a dark purple line down here. And that's not really a Go Tiger moment. I am an LSU person, but there's not really a Go Tiger moment. That is all these brand new little cells. Those are the nuclei of cells, and they're lined up. These are brand new little baby cells that are being formed on top of a little pink line, and that is called the basement membrane. Okay, so that's a line of cells, basement membrane. Now your epithelium, your skin, it's a little bit different than the lining of the intestines in that as new cells go, they push the old cells out. And these cells, as they get pushed to the surface, start to die. So if you look up here at the top, there's a lot of white visual. So like you lose sort of that purple component. All this whiteness is kind of dead skin and keratin. And so one of the aesthetic approaches to youth is to shed off some of this dead stuff and show squeaky clean new stuff. Okay, so the skin is also very unique in that it has some sensory organs, pain fibers, piezoelectric pressure sensation components. You've got hair. All of those are important because they allow your brain to communicate almost literally with every cell in your body. There may be a couple of cells that don't have neurologic innervation, but most of them are neurologically innervated. Now, that is critical because that's how our tactile technology, the VTT stuff, works. So later on, when I start talking about these patches, they work using this phenomenon. Your skin can sense even extremely fine pressure sensations to the point where you kind of ignore that you even feel those. This is why your clothes don't drive you nuts. Your body kind of gets used to feeling it, but trust me, you're still feeling it. Okay, endothelium of your intestines, kind of similar. You've got the hot pink basement membrane. You've got these purple cells lined up. These are brand new cells, but it's only one cell layer thick. At the top of those cells, you don't see sloughed skin or scar or anything you shouldn't. You should see some mucus there, and maybe even a little what we call there's like these, they're called villi, but they're little finger-like projections. And so all of these things, they sit on blood vessels. These cells are actually bound together to be waterproof. In your skin, the cells are coated with like a keratin wax-like coating, but in your intestines, these cells are melded together. And so absorption has to take place through your intestinal lining, and it's supposed to go through the cells. In your skin, absorption absolutely can occur, but that's not the primary function of your skin. It's just something that can happen. All right, skin innervation is innervated by the autonomic nervous system, and we've talked about that in the past. There's the parasympathetic and the sympathetic, and that's the fight or flight or the rest and digest. So sympathetic, fight or flight, parasympathetic, rest and digest. And so that is the auto. You don't have control over that. It happens, usually based on something you see, hear, feel, touch, or think. You can fire off that system with one of almost any sensations, okay? The skin also has the sensory input, as we talked about, and it has an immunologic function. You know this because you can be allergic to something and get a rash on your skin. That's the immune system coming to the skin. So the epithelial surfaces and the endothelial surfaces protect you from invasion from external forces. But it's got to let you interact to a certain degree because your body needs some of these external forces, right? You need some salt, you need some hydration, you need the food, et cetera, et cetera. So it's a fine line between protecting yourself 100% like a plastic wrap and letting too much stuff in and you overwhelm the system in the wrong way that your body can't handle. So it's a fine line. It's what we call homeostasis. That fine line is called homeostasis. Okay, the GI innervation, also autonomic nervous system, parasympathetic and sympathetic. However, it's got two different nervous systems. One comes directly from your brain, whereas the skin, for the most part, there's some exceptions in the head and neck area, but for the most part, your skin is going to be innervated by nerves that originate from the spinal cord, whereas your intestinal tract is innervated directly from your brain, which is why the brain's connection to your intestinal tract is a lot more direct than it would be from your skin, if that makes any sense. The intestinal tract is very unique. It has its own innervation system. It's called an enteric nervous system. And it melds with the vagus nerve, which is in direct communication with your brain. So in this way, your brain has direct control of your entire nervous system. And we talked about that last time. It's one of the reasons why when you get nervous, you get that pit in your stomach. You might have to run to the bathroom because you got IBS. It's why if you scare your dog, it'll pee on itself. You ever notice that? You're like a little puppy gets so scared it pees on itself. Or goats. Have you seen that? We used to have goats. We didn't have the fainting goats. They call fainting goats. If you scare them, they just pass out. That's an overactive vagal nerve response. But anyway, so that's how the nerves kind of interact with your brain. So your brain is responsible for homeostasis And that homeostasis is based on the input, but your input's coming from so many different places, right? So, input is not just coming from your skin, it's coming from your eyes, your ears, your taste bud. It's coming from your emotions. It's coming from your intestinal tract, from your airway, from your bladder. Like, there's a bunch of different ways input is getting into your brain, and your brain takes all that information and tries to balance you out in the best way possible. As it turns out, aesthetic beauty requires as balanced out as possible. You know this in your own life because when you go on vacation and you're relaxed, you look different, right? There's like an inner relaxation and a glow that occurs. This is homeostasis happening in the parasympathetic world. Whereas when you go to work, you've got, like, I had to give a deposition today. I can't really talk about it, but I do medical legal consulting, and so I'm representing a company, and so my job is to give an expert opinion. I'm going to opine on something for a company, and I'm not under any stress because I'm not the one involved in the argument, but the owner of the company might be so it's a huge company. I'm sure the owner has no clue this is even going on. But anyway, somebody is nervous about it. I am sure the person suing the company is all under duress. And so their appearance is going to be much different than mine. I, I have no dog in the hunt, right? So I can go into that relaxed, and I suspect my relaxation gives me a different visible appearance. And I think you guys know that in your own lives. When you're under stress, it's finals. Maybe you're in a divorce. Maybe work is getting you down. You have a different demeanor and a different. You can age. You can age prematurely based on those things. Okay, so what causes the aging appearance in your skin? Several things. First of all, thin skin. As we age, we lose collagen deposition in our skin. And this is why, and I think women start to, like, God knows I did. I never paid attention to my skin at all. I still don't really have a skin regimen. Isn't that crazy? I own a med spa. Why don't I have this regimen? It's better now. I used to just wash my face with shampoo. I know I just freaked everybody out just now. All the women in the room were like, I didn't see a problem with that. I'm already up there with my hair. Why not? Anyways, you got it. Thinning of the skin occurs starting around age 25, 26, 27. And so that's the time to start engaging in this thing. It's never too late, really. But thinning of the skin is step one in the aging process. Wrinkles. Wrinkles we talked about is facial expression. And one of the reasons I stayed this far back from any camera is because I'm very facially expressive. I got the wrinkles, right? And I don't really do the Botox. That's another weird thing about owning a med spa. I've never done the filler. I'm scared. I'm not scared of needles. Just I'm scared of changing my personal appearance. I'd like to use health. Here I am, almost 56. I think nutrition has helped me quite a bit without using the aesthetics. But some people like that, and I have done I do like the Botox. I just don't have time for it. But anyway, irregular complexion. Now I do struggle with that, and I have had a series of photofacials, which will help with the irregular complexion. That's skin damage, sun damage. Then there's jowls. Ooh, and I'm starting to get those. Oh my God. And then there's scowls. It's where the corner of your mouth starts to droop. And all these things are related to facial remodeling. And so this is the aging process. Now, and I think the men watching this could care less, but the women are very interested. I'm going to give you some advice right now. Okay. So when it comes to the shapes of your face as we age, you go from the teenager that has an oval shape. Your face will be ovally shaped until you're in your 20s. And then your shape starts taking on an upside down triangle kind of phenomenon. This upside down triangle phenomenon is sort of, I don't want to say the aesthetic standard. The oval face is maybe a little bit too young looking. The upside down triangle is kind of the aesthetic standard. when you get to be my age, and this patient is, down here is one assumes 5 or 6 years older than me, but, you get almost a square. You still have your cheeks, but you're starting to get a little bit of a blunting of this chin feature, and so you get kind of a square, and then as you age, that triangle, um, turns upright, so this older lady has got the upright triangle thing. Now, why is that important? We use these facial shapes to engage in filler. Here, I'll go back to that slide. So, for example, this square shape, you can turn back the hands to the upside down triangle by giving this person's cheeks just a little bit more filler, by resurfacing the skin just a little bit to kind of shave down these side corners. You can even reinforce the chin. So you utilize filler, Botox, and resurfacing to go from here to here. This old lady with the upright triangle, if she tries to achieve the upside down triangle, will look like an alien. And this is the problem they do in Hollywood. I'm telling you, y'all don't do that. I don't allow my nurse practitioner is so good. She's awesome. She would never allow you to do that. We never turn back the clock more than 10 years because it looks abnormal. Aging is okay. It's wonderful. And you're not designed to look like you're 27 years old for your whole life. We want to age with grace, and therefore we want to support the natural process. And you can do that through gut health. Thus, the point of today's show. If you want to know all the different ways we manage aesthetic beauty, you can always go to your local med spa. Don't let them talk you into reversing your age more than 10 years. Never tell them you want to be 20 years younger. It's not going to look proper. The R's of aesthetics are as follows. You want to relax the musculature of your face so your face doesn't seem so tense. We do that with Botox, and that helps with wrinkles. Wrinkles are from muscle contraction. You try not to fill wrinkles, you try to relax them. Okay. Resurfacing can involve laser. We use something slightly different, which is a microneedling radiofrequency thing. The recovery time is quicker. It can be used in all skin types. That's why I like the one that I use. But a lot of med spas will use an actual laser. And what that does is kind of beats back all that dead skin down to a fresh layer. And then as that fresh layer kind of heals, it looks more young and vibrant. You can refill areas. You can refill the bone to get rid of bone loss. And then you can refill sulcuses sort of in the eye, tear trough, and then along the upper face if you want to. Some people will use that filler along the jawline. Again, we're trying to change the shape of these triangles and squares using filler in different parts of the body. In some people, what they're wanting is kind of too far gone, and enter your friendly plastic surgeon who does not take insurance, please. That's cash. Okay. So save y'all money and don't let them make you look like you just jumped out of an airplane. You know what I'm talking about. Some of those people have gone a little bit too far. A little Botox. I mean, some people say aging is just a Botox deficiency. So that's a temporary fix. I'm not opposed to the Botox. Okay. What can you do naturally? Let's say you're like me. You're like, I don't know. What if something happens and I get permanently altered? My husband likes what my face looks like. Is really what it boils down to. It's my husband saying, don't do it, because what if you change something I really like? And so, okay, I won't, because I belong to him. Now, what can I do naturally to try to help things? Well, the first is replenish your nutrients, such as collagen. You can rehydrate, rest, sleep, rest from the sun. So sunscreen, the aesthetic people are all into the sunscreen for good reason. Refuse sugar, refuse smoking, and refuse alcohol. Those are 3 things will aid you dramatically. And from a hydration standpoint, we'll talk about from gut health, because we talked about those things last week. All the things I just described improve your gut health as well. So we'll go through them real quick so you can see how They each play on each other. When you hydrate, number one, that is going to bring a youthful appearance to your skin. The component of skin that really contains the water, that holds the water, hydration, is hyaluronic acid. Hyaluronic acid in your collagen is what plumps up the collagen. And when you'll see hyaluronic skin substitutes as well as oral supplements. Now, hydration helps your GI tract. Why? Because the same blood vessels, the same basement membrane, the same collagen, the same create new cell process happens on both layers. They're both the same. It's just you can see one, you can't see the other. So the same reasons that your skin will respond to hydration, your intestinal tract is responding to hydration. Hydration increases blood flow. Because it increases blood flow, it improves detox. Your body has to get rid of toxins. Your body has to ship some of those toxins to the liver, some of those toxins to the kidney, and it can excrete the rest of those toxins. But that happens because of water. Chemical reactions require an aqueous environment. So you got to drink water for the chemical reactions and the detoxification process to occur. This is critical. Now, collagen, everything's built on collagen. I mean, that's a scaffolding. It's sort of like when you're building a building, you got to start with scaffolding first, right? You need a frame and all that kind of stuff. This is what collagen is, for lack of better words. There's a bunch of different types of collagen depending on what part of your body you're building, but even the bones have a certain type of collagen in them. It is a matrix upon which other cells grow. The thicker your collagen in your skin, the more youthful your outward appearance. When it comes to the intestinal tract, you don't necessarily need a thick collagen layer. If the collagen layer is too thick in your intestinal tract, you won't absorb nutrients. You just need it to be a healthy collagen layer. You want to improve absorption, but you also want to improve resilience. So there's an optimal amount of collagen that needs to take place. Oxidation, and we talked a little bit last week about the oxidative stress from seed oils and whatnot. And we'll talk real quick about in just a minute on how to replenish collagen and hydration and that kind of thing. Avoiding oxidation. Oxidation comes from the sunlight. It comes from cigarette smoking. It comes from elevated blood sugar. It comes from toxins in your environment and your food, and it comes from seed oils as they get cooked. The way they make most seed oils and when you cook them creates an oxidative stress for your body. And when you oxidate things, the picture I see, and I'm sorry to the Spotify people, can't see the picture, but it's basically an apple cut in half, and half of the apple is turning brown and the other half of the apple is fresh. That browning of an apple or browning of an avocado, that is oxidative stress. You can reverse that in certain ways, like vitamin C. So like in the med spa, I would take that apple and one side we'd coat with vitamin C and the other side we would leave open to air. And you can see the side protected by vitamin C does not oxidize. Okay, so there are going to be antioxidants that you can take to reverse the oxidative stress in addition to avoidance. Now, microbiome, we talk about that all the time. And I know you're thinking probiotics that you consume. What does that have to do with your skin? Your skin has its own microbiome. Now, what you consume not only goes down the hatch, but it's on your hands, gets on your face. It has a tendency to exude elsewhere. So there are oral antibiotics that can prevent ear infections. And I know you're trying to figure out, that must be bogus. How can eating something prevent an infection inside my ear? Like, it doesn't make sense to you. I understand. And it's simply because these organisms get everywhere. You're coated everywhere, including on the inside of your pharynx, connects to your ears as well. But so a good probiotic can improve your skin texture, can improve chronic infections such as your ears or your bladder. And we've already talked about how it can help with anxiety or your ability to sleep, your digestive tract, et cetera, et cetera. So the microbiome is going to reduce inflammation improve the absorption. This is both the skin and the intestinal tract. You're going to help resist infection. And yes, bacteria can promote healing. If you can crowd out bad guys that can infect wounds, then you can promote healing. Now, sleep is critical, and we will harp on stress and sleep because the absence of stress and the increase in sleep kills people. During sleep is critical. It's critical for your children. So if you have children, they need to be getting 9 or 10 hours of sleep at night. During sleep is when children grow. It is when you repair your injury. You redistribute all the tissue fluid while you're sleeping. It helps you control your blood sugar. There's a lot of hormonal things that occur during your sleep. You can improve your gut microbiome. Your brain and your gut talk to each other even at night while you're sleeping, and it can help promote a balance in the microbiome. It also reduces your stress, and stress is a killer. Okay. Cortisol is a stress hormone that gets normalized at night. And so sleep is critical. It is called beauty rest for a reason. Now, some of the things that you should do to avoid oxidation, inflammation, is to go on a gluten-free diet. And really, the gluten-free diet helps you control your blood sugar. Gluten in everyone, you don't have to be celiac or allergic, is going to cause a certain amount of gut permeability. It just is. You may not feel it, but it is happening. And so certain people have more problems with that than others, but it always happens. It's a reproducible fact that can even happen in animal models. Gluten can cause bacterial overgrowth if you are consuming too much of it. It can cause mesenteric inflammation, and more importantly, it's causing a protein called zonulin, which is a toxin that your own body makes in response to gluten. And I will go on a zonulin fest here sometime soon because I find the topic fascinating. Most people don't know much about it, including doctors. And as it turns out, that is the key to avoiding all chronic illness, is avoiding the production of zonulin. Say no to sugar. That's hard for me. We've talked about that. I am a sugar freak. Can't help it. I do good. I get off the sugar, and the second someone hands me a gummy bear, that's it. It's over. It's very, very addicting to me. Somebody help me. Say no to sugar. Say no to alcohol. Alcohol and sugar look very similar. They're both carbohydrates, believe it or not. They both affect liver health negatively, and your liver is responsible for detoxification. I think I just said to combat aging, you have to detox. So you got to say no to the alcohol. I'm not saying you got to be a teetotaler, and I am from New Orleans. So just mind you, I understand you're going to have a drink from time to time, which is cool. You just don't want to do it all the time. Some people get in the habit of a beer every night with dinner or an alcoholic drink, a nightcap at the end of the day. And I'm saying make that a once a week event as a special occasion, once a month event if you can. There are plenty of studies that one glass of red wine, here's my shout out to my European friends, because my mother refuses to do without her glass of red wine. Yes, one glass of red wine has antioxidants in it, not the white wine, the red wine. Okay, it's called resveratrol, and so one glass, not the whole bottle. Everyone chill out. One glass of red wine. So when you're in Europe, accept the red wine with dinner, okay? Because that's good for you. That's why they live long, okay? All right, but too much is going to cause inflammation, and inflammation leads to autoimmune disease, obesity, metabolic disease, dementia. Chronic blood sugar elevation creates, and the acronym is AGE. That's an accumulation of glycation end products. So when sugar is floating around your blood, it attacks to proteins. Those proteins no longer function properly, and they're just kind of mucking up the system. So these glycated proteins prematurely cause aging because they're kind of clogging the gears. So you don't want to have these glycated end products. The most common one is A1C. Everyone has heard probably by now by your primary care doctors, A1C. That's hemoglobin that has been glycated because your blood sugar level is going over a certain amount. Okay. And we use that as a great marker to know what is your long term baseline blood sugar. If it's elevated, you need to stop that. I know you can't feel it, but it is causing extraordinary damage, including some forms of cancer. So, I mean, listen to me very clearly. You do not want to have elevated blood sugar levels, even if you're not diabetic. I know your insulin's working. You feel awesome. That's cool. I mean, you do you. But I'm just saying for longevity reasons, and especially if you want to have a youthful appearance, you do kind of have to stay away from things that cause glycation of the collagen in your skin will definitely make you look older. Seed oils are probably the devil. We talked about that last week. Because of the way they're extracted with hexane, which is a known carcinogen and a toxin. But it's also a known oxidative stress to your body. And then when you cook, you oxidize that oil even further, so it creates free radicals. When you consume it, free radicals are what cause oxidation. You can help offset all of these intake issues simply by training your microbiome to tolerate things well. We talked about that last week. So a variety of fruits and veggies, and if you can get them raw, wash them. But if you can get them raw, that's better. If you cannot tolerate the cellulose, and there's a lot of people who cannot, if you can juice them, that's fine. Don't get store-bought orange juice and drink a big jug, because that's like hundreds and hundreds of oranges at one time. If you're going to juice them, you're going to have to get your own little masticating juice. Take one orange, squeeze it. Take one apple, squeeze it. So there's not as much sugar in it. One of the beauties of fiber in fruit is that it keeps your blood sugar from spiking. So juices can spike your blood sugar. You want to make sure that you're doing very limited amount of juice if you cannot tolerate the cellulose. I hope I explained that properly. But some people, I personally say smoothie it. You can tolerate the cellulose better when you break it down in a blender. It's more volume, so to your brain, you're like, yay, I had a lot of juice. But really, you only had one apple in there, not 500 apples in one little cup of juice. Does that make sense? Your blood sugar will be more stable because there's fiber in that. Add some protein and a little bit of fat to that smoothie, and you've got yourself a perfect meal. You need to hydrate, and you need to stay physically active. Okay, all those things actually help because they help with stress. They help with blood flow. They help with oxidative stress. So, okay, let's pretend you're living in a modern world, and I guess you are since it's 2024. And honestly, you're a go person. Go, 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 go. Go, 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 go. I really wish I wasn't on the go all the time. It's very vexing to me. Everyone demands my time. And as time goes on, I get paid less for my time, so I have to work more. It's one of those nails that's in the coffin of the healthcare system. One of the other reasons why I encourage everyone to be as healthy as possible is because as the doctors get paid less per visit with their patients, they will see more and more patients to keep up with the overhead. At some point, that doctor is going to say, screw this. I will buy an apartment complex and be a landlord. And then you won't have a doctor. And then what are you going to do? So that's what I'm saying. Pay attention, everybody. Focus. Okay, if you were going to take supplements, what kind of supplements would you take? Number one, the whole collagen protein supplement debate is basically this. Collagen is made of amino acids, very specific ones. A collagen supplement is not a complete protein supplement. It just contains all the amino acids you find in collagen. Collagen supplements will, however, contain hyaluronic acid and vitamin C. They're almost always put together. You should check your bottle to make sure, but they almost always package those three things together because when your body sees hydrolyzed collagen in the face of hyaluronic acid and vitamin C, it will absorb it as an intact little mini protein chain and put it right to where your body needs collagen. That's the beauty of taking a collagen supplement. Take one that is hydrolyzed, take one that is grass-fed, organic, non-GMO. If you are a plant-based person, they do make plant-based collagens. There's no such thing in collagen in the plant world, but they'll make vegetarian source proteins with all those things and a vegetarian source hyaluronic acid. And of course, vitamin C comes from vegetables. So you can get a plant-based collagen supplement. Its effectiveness, I really can't speak to. I do know if you are consuming a lot of complete protein sources, along with hyaluronic acid and vitamin C, your body can also make a very nice collagen. So I'm gonna let you decide what you want to do. Just make sure your sources of these proteins are organic, non-GMO. It's really, I mean, I could care less if they're animal, fish based. That is just egg. This is not my argument. I just get the protein. Hyaluronic acid, again, we talked about that. What causes hydration of the skin. Vitamin C is an antioxidant. It's amazing for your skin. They make a lot of vitamin C serums for your skin to directly absorb that. And that is an amazing regimen for your skin. Your intestinal tract needs this vitamin C as well. So don't ignore your intestinal tract. Don't just put things on your skin and then consume bad food, I think is what I'm trying to say. Vitamin E, there's natural sources of vitamin E, obviously, both in the animal and plant world. Vitamin D, your skin actually makes vitamin D when it is exposed to sunlight. However, sunlight causes aging. And so a lot of people will wear a lot of sunscreen to prevent the aging, not realizing that they're depriving themselves of vitamin D, which is not only an anti-inflammatory, but critical for the absorption of calcium and the natural function of your immune system and your musculoskeletal system. So if you're using sunscreen to prevent sun aging of your skin, the oxidative stress of the sun, you're going to wind up having to take a supplement of vitamin D. Zinc is critical for skin. A lot of people are zinc deficient. If you have ruddy and bizarre appearing skin, and I tend to get that, and I got a little bit of the psoriasis thing going on as well, zinc is incredibly helpful. Your body needs zinc for skin to function properly. Selenium, I love. And in fact, the next one that says NAC. So N-acetylcysteine and selenium you can get in one pill, actually. And that's the one that I take. It's made by Now Foods. I don't care which one you take. You can take a supplement for NAC, and if you can find one that has selenium, and they're often bound together, because it's an amazing anti-inflammatory. You will do more for gut health and therefore your skin health as a result of taking NAC. And of course, omega-3 fatty acids. Why? Because your skin, all the cells of your body require fat. The cell membrane is a lipid bilayer. Lipid means fat. You have to have fat in your diet. If you are not absorbing fat, then you are depriving yourself of cell layers, including support for your nervous system. Now, mitigate stress, and I think we've talked about this in one of my other lectures as well, but cortisol elevates your blood sugar, which decreases your immune system. It inhibits the formation of collagen. It alters the microbiome, and it alters gut motility. Stress will kill people, okay? And so now we're going to talk real brief, because it's the last 5 minutes of my lecture, on this technology called Super Patch. And Super Patch uses a tactile technology that the magical sensory system of your skin can sense. And your brain knows that it's there when you put it on your skin. And then your brain will engage in neuronal pathway changes to get your system back into balance. That's what's happening when you wear these patches. There's no medicine on these patches. The patch called Peace interacts with the part of your brain that communicates with the adrenal gland, those things that spark adrenal-based stress. When you wear a Peace patch and do an EEG, it looks like you've engaged in advanced meditation for 4 to 6 hours. So if you do meditation for 6 hours and do an EEG, or you put on a Peace patch and check an EEG about a minute later, they look the same. I got ADD. I can't do the meditation thing. I've tried. I just can't do it. So the peace patch helps. Enter that zen. Okay. That's what it's doing. It's talking to your brain. If you cannot sleep well, and sleep is critical, they have a patch that helps your brain organize sleep. It does not sedate you. It's not going to put you to sleep. But when you lay down to sleep, your brain starts to recognize those signals and can organize the sleep process better. And then freedom patch for pain. So pain causes stress, and we're trying to mitigate stress. If you're like me and you've got pain points, they have a patch for that as well. It's called the freedom patch, and there's no medicines in it. It's not a narcotic. It's not going to sedate you. It's not going to make you feel weird. It's not addictive. All of these patches typically will need a couple of days, maybe even weeks on a chronic use for you to say, yeah, that definitely helped me. In my opinion, the peace patch helped me within 12 hours. The freedom patch took about 4 days. The REM sleep works most of the time unless I've got a lot of squirrel brain going. If I take caffeine, if I got a big event the next day and I'm ruminating about it, it'll affect my sleep, REM patch or not. Now, this company has come up with a new patch that improves blood flow to the skin. And so it's one of the things that caused me to do this lecture. Number one, it's a fascinating topic. And number two, now there's technology that can give you your skin glows on vacation without you being actually on vacation. They call it a Lumi patch. And if I have a big event, if I'm giving a lecture, if I'm taking pictures, it's a photo shoot, I'm going to be on video. Not this morning. This is all natural. I've got my peace patch on because I don't go anywhere without it. But if I've got a big event and someone's taking my picture, I will use one of these Lumi patches because it will actually take some of the tension out of your face and improve the blood flow. And so that definitely helps. That's part of the autonomic parasympathetic system that puts you in that rest category. Now, there's an interesting, because I am sugar addicted, and if someone gives me sugar and I start going on the hunt for sugar, I wind up taking something called a Kick It patch, which will help you resist. It won't keep you from cheating. It helps you purposefully not cheat. You can override that. Your brain can override anything. So anyway, the point of these patches is to reset the autonomic nervous system to homeostasis. But you have to know these patches don't replace things. They support you. They support your brain. You have to do the work. You have to engage in detoxifying your environment. You have to engage in the hydration and the clean eating. When you're doing those good things, you quit smoking, you quit drinking, you don't do the sugar anymore, you're gluten-free, you're not consuming the seed oils, that's a clean diet. You're starting to engage in lots of fruits and vegetables. They're raw. You're smoothing them, you're fruiting them. You can put them in powder. There's a really cool company. I keep meaning to get their link. They don't do an Instagram thing. I think they have a TikTok link. I don't know what any of that stuff means, but it's called Micro Ingredients. It's out of California. It's powder that you mix in water or your smoothie. I put their lemon and their ginger in my water. It's delish because I don't have time to be doing the masticating stuff or whatever. But whatever you choose to do, it's got the micro ingredients in there. You want to do that. That helps train your microbiome. You're trying to stabilize your body so it can achieve homeostasis. And when you've done that, trust me, you'll have an inner glow from the inside out. So next time you go to your esthetician or your med spa, please do. I own a med spa. Come on in, support my nurse practitioner, my nurse injectors, my esthetician. But know that you get more bang for your buck if you're also doing these other things. Get the resurfacing, get the Botox, get a facial done, get the products so you're doing your regimen, but you got to hydrate, You have to eat properly. You have to quit the smoking and the drinking. Damn, I sound like a Baptist minister, and I didn't mean to do that. Could you just don't mean to harass this early in the morning. All right, so now this PDF will be present on my website, drannatoker.com/services. But you can also go to the tab that says Things I Love. Those are the sponsors to my Instagram channel. And now we are on YouTube, Twitter, TikTok. Well, I guess Twitter's called X now. TikTok, Rumble. And then I put this audio podcast on Spotify. And so these sponsors that I give lectures for, that I do research for, are the reasons I can give you an hour-long free lecture at 6 in the morning instead of operating on people. And so support them, and that way they keep supporting me, and then that way I can keep educating you, because I think it's critical. Okay, well, I was going to ask if y'all had any questions, and I don't know how to interact with the questions. Damn it. One day I will. One day I'll have an assistant. Who can show me how to do that. Right now I'm a one-man show. All right, so next week, I don't even know what I'm talking about next week. We'll have to do an announcement. I think I'm going to start diving into blood sugar starting next week. I believe is true. And blood sugar is key. It's clutch. It's critical. It is central to your entire health. You don't even know it. And we're going to learn about that sometime in the next week. And we'll send out an alert to that. All right. So hope you guys have a good week, and we'll talk to you soon.